questions focused on the popliteal lymph nodes, their drainage area, dorsolateral foot and posterior calf, and related conditions like lateral foot leg cellulitis. Question 1. A 42-year-old hiker presents with redness and swelling over the lateral side of his right foot following a blister that ruptured. He has tenderness in the popliteal fossa. Which lymph nodes are most likely responsible for the swelling? A. Inguinal, B. External iliac, C. Internal iliac, D. Popliteal, E. Para-aortic. Correct answer D. The popliteal lymph nodes drain the dorsolateral foot and posterior calf, so infections in the lateral foot can lead to popliteal lymphadenopathy. Why not the others? A. Inguinal equals medial foot and leg. Drain deeper pelvic or abdominal structures. Question 2. A 33-year-old man develops cellulitis over the posterior aspect of the left calf. On exam, there is warmth, tenderness, and swelling in the popliteal region. Which of the following is the most accurate explanation for the lymph node involvement? A. Hematogenous spread to para-aortic nodes. B. Lymphatic drainage into superficial inguinal nodes. C. Lymphatic drainage through popliteal lymph nodes. D. Venous obstruction of the posterior tibial vein. E. Spread via the sciatic nerve sheath. Correct answer C. Lymphatic drainage through popliteal lymph nodes. The posterior calf drains to popliteal lymph nodes, making them the most likely group to be inflamed in posterior leg cellulitis. Why not the others? A and D and E equals unrelated to lymphatic drainage. B. Superficial inguinal nodes drain medial leg and foot. Question 3. A 25-year-old soccer player sustains an abrasion to the lateral aspect of the foot. 3 days later, he develops pain and swelling behind the knee. Which of the following best explains the location of the lymphadenopathy? A. The lateral foot drains into the popliteal lymph nodes. B. The lateral foot drains directly into inguinal nodes. C. The lymphatic flow from the foot bypasses regional nodes. D. The infection spread via arterial circulation. E. The posterior tibial vein is the main drainage route for lymph. Correct answer A. The lateral foot drains into the popliteal lymph nodes. The dorsolateral foot popliteal lymph nodes, deeper chains like deep inguinal. So localized infection results in popliteal node swelling first. Why not the others? B. Inguinal nodes are secondary or drain medial foot. C. Lymph always passes through regional nodes. D. Not an arterial issue. E. Lymphatic, not venous. Question. Would you like a full-body lymph drain